Hi, Mr. Palmer. My name is Rachel Black. I'm a nurse practitioner student working with you today.
Hi.
Would you like me to call you Matthew or Mr. Palmer?
Matt's fine.
Okay, great. Thank you. Can you tell me your date of birth?
6/10/84.
Okay. What's today's date?
4/13/16.
And what was our appointment time today?
4:30.
Okay,
Yeah.
great. I'm going to start doing a head-to-toe physical, starting with your head, if that's okay.
Okay.
First thing I'm going to do is inspect and then palpate. Okay, take a look at his hair. Okay, I'm going to check the sinuses. Okay. I'm going to take a look at all of his skin and check his nails. I'm also going to check capillary refill while I'm here, as well as radial pulses. And I'm going to do the same on the feet. So I'm going to check his nails, cap refill, nails, cap refill, and the PTs and the DPs. Checking for edema and skin integrity as well. Okay. All right. So the first thing I'm going to ask you to do, is your head okay?
Mm-hmm.
Okay. I'm ensuring patient comfort and making sure he's draped appropriately. Is I'm going to take a look at your eyes. I want you to follow my finger with just moving your eyes. Perfect. Now follow my finger. Okay. I want you to look straight at me. I'm standing in front of you as best as I can. And I want you to tell me when you can see wiggling.
Yes. 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 Yes.
Okay. I'm going to have you hold this about 14 inches in front of you. I want you to read the smallest line that you can.
DFPOTEC.
Okay.
DEFPOTEC.
Okay. And then with both eyes.
DEFPOTEC.
Okay. Thank you. I'm going to check your sclera, as well as your lacrimal ducts. Okay. Now I'm going to darken the light for a second. So we can make sure that your pupils are responsive and that they're equal round and reactive to light. Okay. I'm going to ask you to scooch to the end of the bed for me. Okay. So I'm going to have you look straight ahead past me, and I'm going to do a quick fundoscopic exam, checking for the red light reflex first. I'm going to be 4 centimeters away from your face. Okay. Thank you. I know that's not comfortable.
It's all good, doctor.
Nurse practitioner, student.
Practitioner, student.
All right, and I have you back up, okay? Okay. I'm going to check your ears. Can you clench your jaw? Thank you. I'm going to use my otoscope with a brand new cover on it. Thank you. Sorry, I know this is not optimal positioning.
That's right.
Okay. Great. Okay. Now we're going to check your mouth out real quick. My brand new. And this is also brand new. Can you open your mouth? Stick out your tongue. We're going to get a good look. Checking your teeth, checking your palate. Can you say ah? Thank you. Can you stick out your tongue?
Sorry, gang.
Okay. Normally with a gloved hand, I would move and palpate the tongue. Okay, can you give...
Still in the right spot.
Yeah. Can you furrow your brow? Yes. Can you puff out your cheeks? Thank you. Can you give a big smile? Give a big frown? Perfect. Close your eyes. Close them tightly. Try to open them. Great. Thank you. Okay. I'm also going to take a look at your nose. And palpate that. Take a look at your nasal passages. Take a quick look with a disposable cover. Okay. Now I want you to occlude one nostril. Tell me what you smell.
Coffee.
Okay, we're going to do the same thing on the other side.
Coffee.
Okay. We're going to do some hearing tests. I want you to, I'm going to occlude one ear,
Okay.
and I want you to repeat what I'm whispering in the other one.
Okay.
I can do it.
Okay.
1, 2, 3.
1, 2, 3.
11, 10, 9.
11, 10, 9.
Okay. So I'm going to use this. It's called a tuning fork, and we're going to see if you can hear on equal sides the same.
Yes.
Okay. Now we're going to check air conduction versus bone conduction. So I'm going to put this on behind your ear, and I want you to tell me when you stop hearing it.
Okay. Can't hear it.
Can you hear that?
Yeah. Can't hear it.
Can you
Yes.
hear that? Okay. Now I'd like you to close your eyes and tell me when you feel something.
Yes. 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 Yes.
Okay. I want you to hold your head back up and try to take a sip of water after you do that, so I can watch your thyroid. And hold back when you swallow. Perfect. And I'm going to have you lean forward and take another sip of water. Okay. Thank you.
Okay.
Okay, now I'm going to palpate some of your lymph nodes
Okay.
and check your neck and your shoulders. Can you shrug your shoulders? Perfect, thank you. So now I'm going to check your clavicular nodes, as well as making sure your trachea is midline. I'm going to check your pre- and post-auricle lymph nodes, as well as your submandibular ones. That one. Sorry, I know you've had surgery there.
It's okay.
Okay, great. All right, thank you, Mr. Parmer.
You're welcome.
Are you okay to remove your shirt for a minute while we check your cardiovascular and respiratory and belly?
Sure.
Okay, great, thank you. So the first thing I'm going to have you do is sit forward a little bit, and I'm going to inspect your chest and your thorax. I don't see any retractions or accessory muscle use, so I'm going to listen to your lung sounds if that's okay.
Mm-hmm.
Okay. So I'm going to have you, sorry,
Okay.
say a bunch of funny things for me, okay?
Okay.
So I'm going to have you say 99, 99 until I tell you to stop.
99. 99. 99. 99. 99. 99. 99.
Okay. Great, thank you.
You're welcome.
I'm going to have you say 99 again.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Now I'm going to have you say E, E, E.
E, E, E. E, E, E. E, E, E. E, E, E. E, E, E. E, E, E. E, E, E. E, E, E. E, E, E. E, E, E. E, E, E. E, E, E.
Okay. I'm going to have you whisper 1, 2, 3. 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, great. So now I'm going to do what's called percuss your chest. So I'm going to tap on it a little bit. And I'm going to have you take and hold a deep breath when I tell you, okay? Okay, can you lean forward? All right, can you exhale your lungs all the way? And hold it. All right, take a deep breath and hold it. So I'm percussing on both sides in order to check your diaphragmatic excursion. Great. And exhale. Can you take another big deep breath for me, please? And again. Perfect. Thank you so much. And you can relax. All right. So now I'm going to listen to your lung sounds in several different places in a bunch of different positions, if that's okay.
Okay.
Okay. I'm going to start across on the right side. Just breathe normally. Okay. And I'm going to have you sit straight up. Can you tap the monitor real quick because it's about to go dead? Thank you. Now I'm going to have you lay flat on your on your left side. Thank you.
You're welcome.
Okay, great. Thank you. Now, if you could, you can lay back on a pillow to where you're comfortable, but mostly flat. All right, now I'm going to check for the point of maximum impulse on your chest. Make sure there's no thrills or anything. Okay. So now I'm going to go through and palpate your carotids as well as your temporal arteries because I didn't do those earlier, as well as listen to them. I'm also going to be checking your other pulses throughout your body and listening to those as well. I'm going to listen with the bell of my stethoscope and be sure to not do both carotids at the same time so I don't kill them. Check your brachial. Other brachial. Okay. And I already did your radial as well as your pedal. So I'm going to check your popliteals. While I'm doing this, I'm also going to listen for a bruit in your aorta. As well as your iliacs. And your femorals. Okay. I'm going to listen to your bowel sounds on all 4 quadrants. And now I'm going to percuss your belly. In all 4 quadrants. Paying special attention to the gastric bubble, the bladder, checking for liver span, and over the spleen. Okay. Now I'm going to press on your belly a bit in all 4 quadrants. First lightly, and then deeper palpation. Let's see if I can palpate the aorta. Check if there's pain upon bladder palpation. I'm going to see if I can feel liver. Okay, I'm going to have you rolled a little bit that way if that's okay. And take a deep breath. Okay, and then back flat. Check for the spleen. And now I'm going to listen over your liver and your spleen. And I want you to take big, deep breaths. Okay. Now I'm going to remove your pillow for 1 minute. And I want you to keep your head lifted up so I can check for hernia. Perfect. Thank you. Pillow's back. Okay. So now I'm going to run through and move your joints around. I want you to tell me if anything hurts, okay? I'm checking for crepitus in the joints. Range of motion. Okay. Okay. Are you comfortable laying down, or would you like to sit up a little bit?
Whatever works for you.
I'll have you sit up a little bit. Here, you can scooch back. If that's okay.
It's perfect.
All right, so we're going to do some strength testing now. I want you to shrug your shoulders. Good. Okay. Grab my hands. Squeeze as hard as you can. Perfect, thank you. I want you to pull my hands towards you. Great. Push me away. Great. Okay. I want you to, toast the nose, push down like a gas pedal. Jesus. Bend your knee. Okay. Bend your knee. Okay, great, thank you. Okay. we're gonna do some stuff. Okay. I would like you to close your eyes, and I'd like you to tell me if you feel something when it touches you and where you feel it.
Right shoulder, right leg, left hand, right forearm, left knee, left foot, right foot, left arm.
Okay. We're going to do that again. Is that sharp or dull?
Sharper than it was.
Good. Right answer.
Right hand.
Is that sharp or dull?
Dull. Left leg sharp. Right leg dull. Left hand dull. Sharp.
It's dull.
Left arm sharp. Left leg dull.
Okay. Close your eyes again, and I want you to tell me what you feel.
Vibration.
Yes.
Vibration. It's vibrating. Vibration. 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 Vibration.
I think I did that one twice by accident.
Vibration.
Okay, great. All right, I'm gonna keep you with your eyes closed. And we're gonna test another thing. Just relax your hand. I'm gonna move some fingers and toes around. This is up, this is normal, that is down.
Okay.
So I'm gonna do that, and I want you to tell me which direction that I'm going in.
Up. Down. Normal. Down. Normal. Up.
I'm gonna bend your leg for camera's sake.
Okay.
So this is normal.
Yeah.
That's up.
Okay.
That's down.
Okay. Down. Normal. Down. Up. Down. Normal.
Great, thank you. All right. Can you spell world backwards?
DLROW.
Okay. What does it mean when I say the squeaky wheel gets the grease?
The people that whine the most get the most attention.
Okay, sounds good. I'm gonna ask you to close your eyes yet again. I apologize.
It's okay.
I'm gonna put an item in your right hand, and I'd like you to identify it.
Okay. Feels like a quarter.
Good. I'm gonna do the same on the other hand.
Feels like a dime.
Okay, great. I'm gonna go through and check some of your reflexes, okay?
Okay.
Okay, and just relax your arm. Okay. Are you okay with scooching to the end of the bed for me again?
Sure. I'm with the camera.
What? Go up here a Okay. I'm going to check some more reflexes. Okay. So I'm going to ask you to stand and walk a few steps so I can assess you walk.
Okay.
You can walk this way. Okay. And I'm going to have you walk on your toes back. Okay. And on your heels towards me. Okay, great. Thank you. Okay. I'm going to ask you to close your eyes and do what's called the Romberg test to make sure you don't fall over. Great, thank you. Can you hold out your arms straight? Close your eyes. Great, thank you. And have a seat. I'm going to ask you, with your eyes open, to touch my finger and then touch your nose. Okay, great. Go like this really fast. Okay, and then flop your hands back and forth really fast. Okay, great. Thank you so much. Okay, I'm also going to assess your back. This is an okay position. I'm going to check your spine and palpate your spine, as well as the muscles along your spine. Okay. All right. Well, I think we're done for the day. Do you have any questions about anything?
No.
Everything looks fantastic.
Thanks.
All right. Thank you, Mr. Palmer / Matthew.
You're welcome.